righty. Very good. Thank you, everybody. I think we've got a full house. So we'll go ahead and get started. This is the Phasis Group periodic free webinars, and we appreciate everybody who is taking the time out of their day to attend. A reminder that we're recording this webinar, and we'll post the recording on our website. So if you have to bail, or you want to look at something again, or you want your staff to watch it, we will have that available to you on our website. So today's webinar is talking about the patient portal that is an inherent part of CareTracker. Let's see if I can do it. There we go. So on the agenda today of what we're going to cover is we're going to take just kind of an overview look at the patient portal and discuss why the patient portal was even created and kind of what the future might be in terms of compliance and just a kind of a high-level discussion about the patient portal. Then we're going to spend the majority of our time with hands-on demonstration, and Cheryl Thomas, our support manager, and Brad Sklar, our EHR expert, are both going to spend a little bit of time showing you exactly what the patient experience looks like, as well as what it looks like for you as providers to be able to publish things to the patient portal. So we tend to we're going to plan on taking you through both the practice side of this as well as a patient view. I don't know if any of you have ever had a chance to see the patient side, but that can sometimes open up a lot of insights into what patients might be dealing with when they're trying to leverage the patient portal. And then we'll also deal with what it is you guys have to do on the back end to either publish documents or manage patient requests or just helping patients get connected. And we'll give you some support tools that you can use and leverage. And then at the end of the webinar, we'll take as many questions as we can handle. So I think we have a pretty full slate. So I'll go ahead and jump in with the overview. Before I do, is everybody hearing me okay? Is everybody able to view the presentation? I'll take that as the lack of a no as a yes. So the patient portal was originally created prior to meaningful use even being on the landscape. The patient portal was designed to enable practices to be able to securely communicate with their patients and solve some of the problems around that real-time communication. Anytime you were sending test results, it's going to take a photocopy and then a postage stamp, and somebody's got to send the thing out, or you're going to spend a bunch of time on the phone talking to the patient. The patient portal was designed to actually give you a tool that would save you time and money to communicate with your patients. Some of the other things that the patient portal is designed to do is to allow a patient to see their financial situation within CareTracker. They can do statements, they can actually pay bills if you have turned on the Instamed Payment Connect feature within CareTracker, and that would require you actually using the Instamed Merchant Services. The other things that patients can do is schedule and confirm request appointments. There is also the Ask a Patient feature that you can turn on. So as we move towards meaningful use, some of these items are going to be mandated that you use and show certain tolerances. But I think the important thing to understand is before meaningful use came along, the patient portal concept was there to make your efficiencies better and also to make the patient experience better than just dealing with snail mail and that type of thing. All right. So quick thing about meaningful use and the regulatory concerns. When we're talking about the patient portal and how it's going to affect your reporting to CMS, a couple of things to keep in mind. The first thing is that for meaningful use, there will be thresholds that have to be met. Thresholds relative to how many patients in your practice you actually have signed up for the patient portal. Those thresholds, I think, are currently at about 10%. And then there's also a threshold for actual meaningful use of the patient portal. Specifically, we're talking about the requirement in the current stage 2 meaningful use for a view, download, and transmit of some patient information within the patient portal. Whoops, sorry about that. And then, of course, where all this is moving to is away from meaningful use and towards the different reimbursement models that are covered under MACRA, and that is where you're moving away from, relative to CMS, fee-for-service and moving towards getting paid for performance. It's going to be kind of an ugly transition, but part of what you're going to have to deal with are all of the different elements of PQRS and meaningful use. Even though you may not have to attest in order to get full reimbursement out of the different payment models, you're going to have to demonstrate that you're using patient portal among the other meaningful use items. So that's just one concern that I want everybody to have in the back of their mind. If you approach the patient portal with how can it make my practice better as the primary concern, and then make sure you're covering everything from a regulatory perspective, I think you'll be well served. So one of the things that we're going to talk about is the patient sign-up. So there's a couple of ways to get patients engaged with the patient portal. One is to activate the patient and turn them loose. You give them a little document and they have to go register. The second way to do this is to do what's called pre-registering. Pre-registering is where you, as the office, actually take care of a little bit of what the enrollment process is going to be on behalf of the patient before you turn it over to the patient. Cheryl's going to take you through how you as a practice activate or pre-register a patient, and she's also going to show you exactly what it looks like from the patient perspective. And we'll have ample time to ask questions on that. I just kind of want to give you an idea of what lies ahead here. And then, I'm not sure how that one. Okay. I'm going to go ahead and somehow I've got the wrong slide presentation. Cheryl, are you prepared to take it away from a demonstration perspective where we'll show the
Absolutely.
sign
Yep.
in? All right, very good. Let me go ahead and pass it to you then.
Okay, good morning, everyone, and you should all be seeing the CareTracker dashboard. And before we get into the patient or the registering, I just wanted to quickly show the patient portal sign-up. So when you're in administration setup, we have our patient portal. The Allow Patient Portal features is where you can decide what the patient will be able to do and what they'll see on their side of it. So if you would like the patient to be able to request an appointment, you select that here. If you want them to be able to update demographic information, ask the practice is sending you messages, etc. So all of these features here, you have control over which of those you want the patient to be able to see and which of those you want to utilize. So if anybody has any questions about that, we can come back to that part of it also, though. Okay, so two ways we have of signing the patients up for the patient portal. And for the first one, we're going to just pull in one of our patients. You have to have a date of birth and an email address on the patient's demographic screen in order for these to work, particularly if you're going to pre-register them. Practice details is where you'll find this patient portal information. And for the first one, we're going to just activate this patient. So this little button right here that just says activate, we activate that patient, and it assigns the patient a patient identifier or registration number that they will need when they go to register. Then we can do the patient printout. We're going to pull that up here. We won't really print it. And it will give them that registration ID number and a few steps here on how they follow along to get registered. It'll tell them where, the website to go to, how to follow the steps to get the registration complete. So what we'll do now is we're going to go over to Health Tracker. Patient, you've given that, and they go home, and now they've gone to healthtracker.com. This is the first page they're going to see. They're not registered yet, so we're going to register. So they need to choose a username and a password. Security questions. And then they're going to enter personal information, their email address, and I used mine because it does have to be a valid address. Confirm our email. And so you'll see this way, the activate way is a little bit more work for the patient, and we'll definitely show you the other way, which seems a little bit easier on them. Oh, holy heck, I'm sorry. I don't remember what date of birth we had for this guy. I should have written it down. 4/13/08. Luckily, I can do that. So the patient would probably know their date of birth, but since we're using fake patients, I want to make sure I'm doing the correct one. Okay, this part right here sometimes is tricky for the patients because now they're going to go out and they're going to search for their provider. Now, you have to use at least 2 letters of the first name and some of the last name, and we're going to search. Now, sometimes if your provider, you want to know how your provider is listed in there. So if they have, like, maybe they're going by their middle name instead of their first name, and that's how you know them, we want to make sure that if you have a provider like that in your practice, that you're giving the patient the correct information. So when they search for the provider, they're going to be able to find them. Because that's one of the biggest complaints I get is they go to search and they can't find their doctor. So then we're going to click on the provider we want, and you'll see how it kind of highlights it in yellow. And then we're going to enter that registration ID number down here that we were given on that sheet. And then we'll register. There you go. Now it says we've been pre-registered, and email is sent to our email address on file. We need to open the email and just click on that link to complete that registration process. And so here's our email. This is
Cheryl,
what the
page... Just had a question on the share I thought we'd go ahead and address as it came up.
Sure.
Dr. Abloff is asking how often the provider database is updated. And so basically the providers are entered into CareTracker the first time they show up in the NPI registry, and then they're only updated as CareTracker users identify that there is a change. So as all of your providers that are in your office, those are going to be up to date, and anytime a change is required, it would be incumbent upon us as your support entity to communicate that change. If we're talking about referring providers, you may actually find, as you're dealing with the referring providers, that what's in CareTracker is not the most up-to-date, and at that point you just shoot over a request to the support desk, and Cheryl gets those updated for you. So sorry to interrupt, Cheryl. Please.
No problem. So yeah, as Matt said though, if the providers in your practice, they should be up to date. And again, if you have any, like you've changed address or something, that would be up to us as your support to make sure that the information is correct in CareTracker. Okay, so now we have our email. This is what it's going to look like when the patient sees it. They simply just click on this link, and it will then take them back to that sign-in page where they would use the information that we just entered and sign in. There we go. And then we're going to go to this practice. So that one, that's the first way to do it, which is activating, and that kind of is a lot of information that the patient is adding. So the second way, which is the way that we really do recommend for you, it's a little bit easier.
And Cheryl, while you're bringing that up, I'm going to address another question. Debbie Rasmussen is asking, how's the process different with multiple family members? Does each person have a different account? So this is attached to the medical record account, which is the patient account, not specifically a separate login for the responsible party. So how it will affect patients using the patient portal is each actual physical patient will have their own unique login. If they're leveraging the looking at statements, that's when it would pull up based on a responsible party. So if you had 5 family members that all participated, they'd all have their own 5 logins, they'd have 5 separate medical records, but each of those 5, if the billing were tied to the family, when they go to the statements, they'd all see the same statement. So hopefully that addresses the question. Please continue, Cheryl.
There is also, Matt, just one addition to that. Once you do have a unique username for each patient, but once the patient is registered, they can assign an authorized person also. So if they want to have somebody else be able to access their portal information, that's possible, and we can get to that when we are showing the patient side.
Excellent point. Thank you, Cheryl.
Okay, so now for Ben, what we're going to do this time is we're going to pre-register the patient. So again, when we pre-register the patient, we have to have an email and a date of birth on file in his demographics. And when we pre-register the patient, it just sends them an email, and you'll just get this pop-up to let you know that the email has been sent to pre-register that patient. Now, we have come up with a document that we use, and I need to find it. I'm sorry. I thought I had it open, and I did not. So I'm going to go over here. I'm sorry, but apologies.
Quite all right. So this document that Cheryl's locating is designed to assist the patient with their registration. We're happy to share this, and just let us know if you need that, and we'll be sending out a sample of this when we send out all of the materials from this webinar.
Absolutely. So this is something that's not really in CareTracker, but we've come up with it that kind of helps the patient through this. So then you can just write in the patient's name and the account number. So these first 5 digits are going to identify your practice, and then the next series of numbers are going to be the patient account number. And we want to make sure that we're using the account number, not the chart number. And we'll go back to that, and then it'll just give them a little bit of instructions again on how to follow, how to get there and complete that registration. So once we've pre-registered, you'll see up here the account number is the number that's in the box. Now in this case, the patient has the same number for the chart number and the account number, and that's very common, but it's not always the case. So you always want to make sure that you're giving them the number that comes up in that box, which is that patient account number. What it does then is it sends an email to the patient. So we'll bring our email back up here. Now this one's a little bit different because we've already given them all that information to pre-register, so it has a link that says continue registration. When the patient clicks on that link, it takes them right to the CareTracker website, and now they can skip all that, put in your first and last name and find your provider and all that kind of stuff. So all they simply have to do is create this username. I don't know if this will work, but we'll give it a try. Security questions again. And then account verification, and here's where they're going to put that account number in there. So when you gave them that form with that account number on there, that's where this will come in to play, because they'll have to have that account number. 4, 5, and I failed to write it down, so we are...
Cheryl, while you're looking that up, Brett has a couple of points. Obviously, Brad, Bruce, Cheryl have helped patients to get registered, and so one of the points that Brad was mentioning is make sure that you're kind of telling the patient, and this kind of goes without saying, but say it anyway, to please write down your email that you're using, your username, your password, those three things. If you don't have username, email, and password from the patient's end, you're going to end up getting shut out at some point. Then we have to go through the password reset, which we'll show you.
And the password has to have a capital letter. It has to be 8 characters long with a number as well. So capital letter.
Okay, so we've
characters.
all right, and now it says we've successfully registered for the portal. So you see, that way is a lot easier than the first way. So we do recommend that you pre-register the patient. It makes it a lot easier on their side. They are not going through having to find their provider with all those little nuances that may be in the provider name. And so all they really are doing is creating their username, password, security questions. As long as they have the correct account number, it's very easy for them to go forward that way. So a lot easier for pre-registering than to activate, but really either way is okay. It should work both ways.
Great, thank you. And Joe, so that's how you activate or pre-register. We recommend the pre-register, and we've got the different documents to help you, and we're happy to help you with office scripts if you need, what the talk track would be. Before we circle back and show you as a practice how to manage the patient portal, what Cheryl's going to spend some time doing now is to actually show you the patient portal from the patient's perspective, actually how they're going to use that. And I might mention that we've got a meaningful use question. When we circle back to the practice side, we're going to address meaningful use questions, so I'm going to put that one on hold for a little bit. So Cheryl, by all means, show us the patient experience.
Okay, so now they're all registered, and we're going to go and we're going to sign in. And this is what the patient's going to see when they sign in. This is their home screen. They have some quick links over here to request. If you have those turned on in your practice, they can request an appointment, renew a prescription, ask the practice. There is an activity log. You can upload practice forms. Now keep in mind, when you upload a practice form, that's a form like, for example, a registration form for new patients, or I don't know that you'd have new patients signing on, but a registration form. These are going to be forms that anyone that's on that portal is going to see. So it's not patient specific, but everybody sees that information. So you want to be careful when you're uploading forms that they are not going to the practice form side of things if it's personal information. Messages, this is where the patient will see any information that you've sent over to the practice or to the patient portal, lab results or something like that. One note, though, is if we do have attachments that you want the patient to be able to see, they do have to turn on compatibility view. And we'll just really quickly go compatibility view settings. I already had it in there, and close it. So then we can open this attachment, and we'll be able to see that results that the provider had sent up there. So that's another common issue that I get from patients, is that they can't open those attachments, and that's compatibility view. Has to be turned on for them to see that. That is something that CareTracker is working on, but for right now it's a pretty simple fix. The next one over is going to show appointments, and this is going to just give this patient all of the appointments that they've had in the past. And if they want to request an appointment, they can do so here if that's one of the features that you've turned on. When you request an appointment, they can just select the criteria, which provider they want it with, if you have more than one location, what type of appointment, day of the week, etc. And then they'll submit that. It doesn't put the appointment on your schedule. It simply is a request that you are going to go into care. You'll see that on your dashboard. You have to then find the appointment and then approve it. So it's not something that the patient is just going to schedule their own appointment. They're simply making a request.
And we will circle back and show you what that looks like from the practice side after we're done with the patient statements.
Absolutely. So statements. Now, unfortunately, this gentleman, I thought I had put a balance on his, but maybe if they have a balance due, they can go in here and they can view any statements that they might have had out and what their balance is at the practice. Health record, again, you know, if you've chosen, when you choose the features to turn on, you can kind of choose, do I want them to see their problem list, or I want them to see lab results, medications. So here the patient can really kind of look at their medical information that you have on file and help them to be better engaged in taking control of their own health. Knowledge base is anytime you've given them any information for patient education, we can have that sent here also. You know, you're printing out those education and then they lost it and they want to get another copy of it or whatever. If you've sent it to the portal, it's always going to be here for them to go back and look at. So they can always quickly click on one and it's going to open that document that you may have been able to print out for them in the office. Also can save you, if you're sending it straight to the portal, from having to print all those out. The last one is patient information, and that just gives some general information about their contact information, their doctors, their pharmacies, insurance, the stuff that you have on file. And I do see we have a question about where the request for appointments show up on the practice side, and if you can just hold that for just a second, we will get back to that, and I'll show you that. So that's about it. We also do have, you know, some patients, maybe they go to practices with more than one provider that participates or has CareTracker, so they can add more than one practice. This gentleman only just has this one, our training group, but sometimes they may have more than one. My account is here, and that's, you know, we'll show them their username. If they ever need to, they want to change their password, change their security questions, things like that, this is where that would be done. They can also upload a photo if they want to have a photo of themselves on there. Help gives a little bit overview of some of the information about Health Tracker that they can click on if they need some help with it. And then the sign out, obviously recommend that they're going to sign out each time so that it does stay secure.
Great. Okay. Thank you, Cheryl. So that is what the patient experience looks like. And we'll definitely, there's probably some questions that you have that we can address at the question and answer section. We're going to now shift gears from the patient experience to the practice end of it, where you, as a practice, are managing the patient record for the portal. We're going to talk about things that have to do with actually setting up the patient portal in the beginning. Cheryl will show you what setting up the patient portal involves and what the different options are. She'll also go through how documents get uploaded or how results end up in the patient portal. And then one of the issues that patients will have is when they have trouble with the registration, you as a practice need to either resend a registration or pre-registration document, or you need to help them reset the password. Cheryl's going to show you how to do all of that. And then we also have, as Cheryl alluded to, a document that we're making available to you for troubleshooting. Cheryl will spend a little bit of time talking about the different troubleshooting issues that are out there, browser, what patients might deal with, that type of thing. So with that in mind, Cheryl, I'm going to go ahead and give you the share back, and you can take us through the practice perspective.
Okay. Okay, so the practice, again, in administration setup, here's where you find the patient portal information. Setting up first is you can do your logo, you can have, choose a little bit of limited amount of colors, things like that. Allow features, we kind of went over this briefly, but here's where you can choose what the patient is going to see on their side of it. So if you want them to be able to request an appointment, you would set up the appointment types that you want them to see in the portal versus maybe what you're calling them on your end. renew RX renewals, again, you have to have at least one provider selected, but maybe all the providers in your office don't want to deal with those incoming requests, so you might only choose one or two of them. Do you want them to be able to update information, such as their name, maybe their address, did they have a new insurance? Now again, when you get these requests in, they're simply sending you the information. You still have to approve it and accept it before it goes in and actually changes it on their demographics. The health record, again, what do you want them to see when they look at their health record? Ask the Practice is sending sending like a message back, and you can choose individual operators that they can choose when they send those. And actually, let's go back here for a minute. When a patient is going to send a message, this is what they see. So this drop down is going to say, who do I want to send that message to? Now you can set up queues, like to-do queues in your practice, so that maybe they only see the Ask the Practice as a choice, and then you have someone on your staff monitoring those requests and distributing them to the correct person. Maybe you want individual providers or individual medical assistants or staff members listed by name also. So that's totally up to you how you want to set that up. And then it's just like an email. They're going to put a subject line and a message and then send it. So that's how this Ask the Practice would be set up. And then, like we said, view statements. They can always see their balance in their statement. Allow patient payments and enable quick pay will allow them to make payments. If you are enrolled with InstaMed, that's a feature that you can turn on. The next one over is the managing the patient enrollment, and this is where you kind of get a list of all the patients that are enrolled with HealthTracker. You can see, did they get the pre-registration email or did they just get activated? Here's where you can reset a password for them if they can't do it on their own. Or if you want to, let's say that, you know, maybe you sent that pre-registration months ago and they never completed that registration and now they need to have it sent again. You would simply choose the patient's name and say pre-register the patient. There are filters about how you can find, like, what is the status of the patient, and you can search by patient name. Depending on how many patients you have registered or have on the portal, sometimes this can become a little bogged down and get slow. So have patience, and you know, there are a couple of workarounds that I think, Matt, we can talk about in some of that troubleshooting section as we get there too. Okay, so that's kind of how you were managing it, setting it up, resetting passwords, things like that. Now, as far as how we monitor requests, and one of the questions was where we see that, like if the patient has gone on the portal and requested an appointment, and we should have probably done that, so we had one on here. Oh, no, we do. So right here is where you'll see the patient portal updates. If they had gone on there and requested, hey, I've changed my address, can you update that? You would see it here. Same thing for appointment requests are here. So when you click in here and you see that appointment request, then he's told us, I want a follow-up appointment with Dr. Dunn, and it can be any time. So he's like, I'll take anything. I don't really care. So you can then go on your schedule. You can send the message back to the portal that says this is when the appointment has been scheduled. You can also quickly just pull up the patient information in a little pop-up there. So you have his phone number if you want to just call quickly. And he's got a message here that he needs it really quickly, so he needs it fast. And then once that's done, it'll send it sends the appointment information back to the portal, and it will send Fred an email saying you have new information on the patient portal. So he gets an email that said you've got something on there you need to go look at, and then they would sign on to the patient portal and see when you've scheduled that appointment.
Right, I think just want to make sure everybody gets that the patient portal is a secure totally locked down, bulletproof way for you to communicate with the patient so that you're not exposing protected health information to the internet. Now, anything that happens to go over the internet, which is going to be the emails, those will simply tell the patient that they have an action that needs to be looked at, and they actually won't know anything about that until they log into the patient portal account. So anytime you're responding to any of their requests, whether it's an ask to practice or a request about a payment or scheduling, you have control over what they see and don't see, and your communications are totally secure, so you don't have to worry about, oops, I need to use a direct or something like that.
And one of the things I know that I hear from a lot of practices, especially about the demographic or updating information or appointment requests, is, you know, they're concerned that the patient just schedules the appointment, which is not the case. They're requesting the appointment. You still have control over the schedule, and you can put them where you need them and then send it back. They're simply sending that request. So it can free up a lot of phone time for your staff, because that's the way they can monitor those requests maybe at a little bit better timing than on a Monday morning at 8 o'clock when your phones are going crazy. So it might help a little bit with timing. The last one was the prescription renewals, and those don't actually have a separate spot for the patient portal requests, but they are just put in with the renewals that you get also from the pharmacy. And you'll see when you come in here, the request type is all, but if they were sent from the patient portal, you can narrow those down and just see the ones from the patient. So they just kind of group all those refill requests together. Okay, so I'm going to move on. Let's see, I think we have a question here. Quick way to go directly to the schedule and respond. And bear with me, I apologize, I haven't done this one for a while. So I guess there's not really a quick way to, oh, right here is, okay, so he said he wants any time, and he'll take any appointment with Dr. Dunn. So we have this little search thing that's going to find an appointment, and we can, again, control it. You know, maybe Dr. Dunn doesn't work on Thursdays, so we're going to unclick Thursday, and then we'll leave it there, and we're going to find it. So then what it does is it brings up all those available appointments for Dr. Dunn that fit the criteria we asked it for. We're going to choose this one on Friday, 8 a.m. And then when we say book right here, it takes us just like you are used to seeing at your on your schedule. We're going to do a follow-up and save it. Okay, so that appointment has been booked, and it comes off our list that it's taken care of. So now if we go onto our schedule and we go look at Friday, you'll see there he is right there.
And
then
one of the strategies that some practices will use is if they have a single monitor, then of course what Cheryl is showing you would be exactly how they would navigate. If by chance you have dual monitors set up, you can create separate sessions. So you could literally be logged in on one session, and on a second session you could be perhaps showing the schedule. So there are ways around that, and what I would recommend is that if anybody is using the patient portal, and one of the things that their front desk is struggling with is how to manage any of what we're showing you without an excessive number of keystrokes, that's where I'd recommend you give us a shout. Cheryl can spend 10 minutes kind of showing how to set up a secondary session, or other ways in which you can save a couple of keystrokes, which can be huge during the course of the day.
Now, when we did it this way, it automatically will send that message back to the patient to say your appointment has been scheduled at this date and this time. If you were going to do it the other way, you're going to have to, you know, if you just went on the schedule and scheduled the appointment, you would then have to send the patient a message separately through a to-do And I think and this is the same way you would send any kind of message, you're going to go mail, and then you're going to choose that patient, and then send them that message to say, we have scheduled your appointment at this date and this time. So doing it from the dashboard really will save you a lot of clicks, I think, a lot of extra work in messaging them, and it all kind of links together. So it's pretty user-friendly, I think. But again, if any of you have questions or you want to look at different ways of doing it, let us know. I'm happy to spend a little bit of time with you to go over the different options of how you can manage those. Okay, so I'm going to move on.
Good. All right, so why don't we do this? I'll take the share back briefly. All right, so let's talk about troubleshooting, and then what I also want to do is kind of circle back to the questions, and we'll make sure that we adequately answered everybody's questions. Brad has been responding in the chat too, so we'll kind of open it up. But one of the big things that you have is the troubleshooting. So the patient tries this, they get in over their head, and it just isn't working. So we've got a couple of tools, and we'll be sharing with you. There is the actual CareTracker Patient Portal manual, which is accessible inside of CareTracker. We're going to send that out to all the participants. That is literally the user manual for the patient. And it's written like all the other manuals for CareTracker. So feel free to excerpt it if you want. Probably not something you want to send to patients unless they're pretty tech-savvy. We have created for you the CareTracker Patient Portal tips, and that is a document that you can share with patients when they're having trouble getting their browser configured. And I should mention that as far as browsers go, CareTracker, the Patient Portal, it's fully operational in Internet Explorer, but you have to have compatibility if you want to view the documents. It's also fully you can navigate everywhere in the Patient Portal using Chrome, but in order to view documents in Chrome, they would need to emulate Internet Explorer. So it's still a viable option, but I really would push patients towards Internet Explorer. And on the near horizon, in the near term, CareTracker is committed to making the Patient Portal totally operational without the need for compatibility view in both Chrome and Internet Explorer, and they're getting very, very close on that. I think they've kind of shifted gears to escalating the speed with which they increase the server capacity and to doing the things to move to the more highly available network, which is why, by the way, you guys have seen a little bit of interruption with the last month or so. Is as they move towards that, there's just some, unfortunately, maintenance that's causing temporary outages here and there. So when they get past that, they'll return their focus to the browser issues with the Patient Portal. But so you're going to have the manual from CareTracker. You're going to have our tip sheet. You can always call us, send us a to-do, send us an email, and we will gladly assist you with working with the patients on this. Now, there are limitations, and the limitations are both technological and kind of human, if you will. The limitation on the technology side is the portal only really works the best in Internet Explorer. You can use it in Chrome, but that's a limitation there. If they're trying to use it on their iPad or their iPhone, it's not going to be a good experience for them. The other limitation, and this is one that I want everybody to really kind of open their eyes to, is the patient themselves. I think, if the patient is wanting to use the Patient Portal for this, then they're going to be motivated to overcome any of the troubleshooting issues they have. But I would not be pushing non-computer literate patients to try to navigate this. It's fine for logging on and looking at a schedule item or something like that, but if you want to use it for transmitting test results and true impactful clinical purposes, just consider the limitations of the patient. I'm thinking of my 93-year-old mother who uses the patient portal with her doctor, which means actually I use the patient portal for my mom when I'm seeing her. So just kind of keep in mind the human side of the limitations. So why don't we open it up to questions and make sure that we've answered things. Brad, I know you were kind of talking through the different questions. You want to, for the sake of the group, you want to kind of rehash the responses you had on relative to meaningful use?
Sure. The question about meaningful, or how meaningful use really relates to the portal, is two-part. One, you've got to give your patients access to the portal within 4 business days of their scheduled appointment. So everything's tied to the scheduled appointment for meaningful use credit. And that's the first part. And then the second part is that the patient logs in, and you only need 10% by rule at this juncture. But you have to have patients log in and actually click on the View, Download, Transmit button on the Health Record tab of the patient portal. And then once they click on that button, then the practice gets credit for that part of the patient portal access, and that has to be during the reporting period.
Cheryl,
so hopefully that's all clear.
You want to log into the patient portal from the user side and show them that the blue button initiative. And I know Dr. Glove asked, when does it count towards meaningful use? Not the view download, but the patient registration. And the answer is the minute that you register or pre-register a patient, you're actually covered. You do not need the patient to actually log in and use their account, just by virtue of the fact that you have pushed this information to the patient. You're hitting the usage measure from the patient perspective. View, download, transmit, totally different. And that's right. What Cheryl's going to show you now, the blue button.
You want to tie that, you're tying that to a scheduled appointment within that reporting period. That's the key.
I'm sorry, I muted myself. So the patient has come in for an appointment, and within 4 days, you have sent that information over to the portal, and then the patient will see this button here, View, Download, or Transmit Data. So they click on that button, and that will satisfy that piece of meaningful use. It's going to take a little while. There we go.
Yeah, and they don't have to click on download or transmit. That's only if they're going to take this record, put it onto a CD or something like that, and give it to another physician or clinic, you know, that they can actually import this CCD, Complete Care Document, or CDA, Complete Document Architecture, what all the acronyms stand for. But the patient doesn't have to do anything further from there for the clinic to get credit.
And Brad, am I correct that the practice first has to send the information, and the way we're going to do that is when you're in the medical record, the patient has their appointment. Up here under View, you're going to choose one of these, correct? And then we're going to do it. So then you're going to send it as a to-do to the portal, and when you send that up there, that's when they will see that blue button here.
Correct. So that means that the clinic also has to at some point create the CCD or the CDA when they're in the medical record summary portion of the chart.
Right.
So one thing I want to point out is there's a lot of turmoil today around meaningful use and what lies ahead for the next 2 years. So during the next 2 years, if as a practice you've already received all the incentive money that you were entitled to, over the next 2 years you could actually just apply for and receive the waiver. There's going to be a blanket or a mass exemption. So you wouldn't have to go through the bother of actually attesting each of the next 2 years, and you would still avoid any future penalties. However, keep in mind that 2 years from now when MACRA starts to hit, you're going to be expected to be hitting all of the measures, all of the thresholds, and if you're not, your reimbursement will be impacted. So I think what our point is, use the dashboard, use the thresholds, monitor it. You don't have to sweat the the 0.5 percentage points like we used to when it comes to attestation in terms of this calendar year, but what you want to be able to do is make sure that all of your maintenance numbers are well above the thresholds going into MACRA. Otherwise, you're risking reimbursement.
This is conjecture on our part as well. You're much better off playing by the letter of the law and making adjustments as they announce them, as opposed to deciding that you're not going to pay any attention and you're just going to go for the exemption.
Cheryl, one of the questions we also had was about setting up queues. So queues are not set up in the patient portal per se. They're set up in the messaging, which is the to-do, basically, to-do mail, faxes. And in administration, you've got where you would actually set up queues. So why don't you show just briefly where that's done, and then if anybody has more in-depth questions on that, I'd urge you to contact Support Desk for just, a 5-minute show on that.
So in administration, under the practice tab, the middle section here, you have queues. So this is where you can create a queue. We have a couple here, but let's say we're going to add a new one. Let's just call this, maybe we'll call this portal, patient portal. If I could spell. And if you have more than one group, we choose that. And then we're going to save it. Then we're going to re-click on this, and then we're going to choose which operators are going to be participating in this queue. So once you've created it, you click on it, and then we're going to say operator here. And here's where you'll get the list of all the operators that are in your practice, and you'll choose which one of these you want to be able to see those messages that come in through that queue. So I'm just going to choose a few people here. If I can find myself down here, maybe. I bet that's the wrong sign in. That's okay. So then once you've set it up, it's that easy. What happens is those operators that you've chosen to be part of that queue, when they come in and click on their to-dos, they will see those over here. And you'll see under My Queues, I have the Support Center, but if we had been selected to be part of the patient portal, they would see those there, and then they can see any to-dos that are coming in under that queue. That way you can have multiple people that are managing those incoming requests. So again, when you're setting them up, if you want to set up a queue and have, one or two of your staff member monitor and then direct them to the correct person rather than taking the provider's time, that's something that you can look at.
Great. Okay, and then we had another question. I think you've already answered it, but I just want to remind people. Educational materials, actually anything you're sending to the portal, it really is not having anything to do with you printing a paper copy in your office. It has to do with using the to-do system to send it to the patient portal.
The other thing you can do with electronic labs results that are received, for example, from Quest or LabCorp, is there is a place in administration where you can elect to have those automatically, upon receipt, sent up to the patient portal for view. And that's for electronic results.
Yeah, and that gets into probably an area where a lot of offices get a little squeamish today, which is, do I really want the patient to be able to log in and see everything in the medical record? And I think the approach that a lot of providers have been taking so far is, I really don't want that, so I'm going to limit what they can see. What I want people to start kind of focusing on is the down the road part, which is eventually, if it goes into the patient record, it's the patient's business, and you're going to be mandated that they're going to be able to see it. So knowing that that's kind of where this is going, I would just start to be thinking along the lines of, as you're committing something to the record, just Just like with posting something on Facebook, the world is going to see it, or at least the patient is going to see it. So make sure you kind of have your house in order when you're creating the documents and the notes and communicating with the patient, because once it's committed electronically, it's A, there for all time, and B, viewable by anybody who has the credentials to log into it. Alrighty. So let's open it up to any additional questions. Feel free to chime in if you have any other questions, or add to the chat if there's something that we have not shown you relative to the patient portal. Wow, you did a great job, Cheryl. Thank you very much.
Thank you, and thanks everyone for your time this morning.
So what we'll be doing is we're going to be finishing a recording here. We'll post that up on the website. We will send out the tip sheet that we have created. We'll also send out the CareTracker manual that you have. We'll send out this slide presentation in case there's something useful in that for you. And then we'll also send out the registration, pre-registration letter that we have created to assist practices. And I think, Cheryl, did you mention that that document is actually getting refined by CareTracker, and coming up, it's going to be a slightly different, more patient-friendly format.
Right. So this patient printout that they have now, and I'm sorry, thanks, Matt. They are going to make some changes to this to refine it a little bit, to make it a little bit more informative and a little bit easier for the patients to understand.
They're going to include the doctor's name, full name, and a city and address, along with the account number too.
Good point, Bruce. Yeah, it's going to, all those things that patients stumble on when they have to search are going to be provided, so that when they are searching, they actually have character by character how it looks in CareTracker, and if you enter it character by character, you won't have any trouble locating it. It's when you forget something like Dr. Gilmer's initial is T, and his name is T. Scott Gilmer instead of just Scott Gilmer. Those are the things that trip up patients.
And
all right.
Maybe while we have a few minutes, you can show them where the files will be on our website, especially the troubleshooting manual, which will get updated periodically. Okay.
Cheryl, since you're logged in, you want to just now phasisgroup.com.
Oops, if I could spell. My fingers don't want to work right this morning. Okay, so our website, phasisgroup.com, resources, and then Phasis webinars is where you would find the recordings. Is this where are you putting documents, or are they under documents, Bruce?
Yeah, documents.
So documents is kind of where you're going to find those documents that we talked about. And we do have kind of a sample, and our portal are already up there. Is this that pre-registration handout? So there you go. Now, you will have to take that out and put your practice group number in there. So if you need to know what that is, just let one of us know and we'll get that for you.
Yeah, so if you go back to the tips, click on that.
Patient portal tips.
Right, so you can click on anything in the table of contents and it'll bring you to that section. And again, this is a living document. If we run into something or something gets changed in the patient portal, and we can add it to this.
So it is an interactive.
Excellent. Thank you, Bruce. Okay, so we'll go ahead and close it out. One last thing, kind of a more announcement. The plans are to retire the previous website, CareTracker previous. Cheryl, you want to show when you log into CareTracker how probably most people don't even think about it anymore because current has been working well for everybody. But when you log in, if you have any of your users that are selecting previous, they're at the very bottom, very important. That's going away. And the only bona fide use of previous that we're aware of is providers who have not updated their computers with all of the Microsoft and various Java and different updates. If they have not updated their computer, they may be going to Previous in order to make Dragon work inside of their browser. So if you've got any providers using Previous or any users at all in your practice using Previous, please get in touch with us so that we can work with you to make sure that you aren't going to have problems when you next try to log in and Previous is not there. So, all right, thank you, everybody. We very much appreciate your participation, and we look forward to seeing you all on future webinars. Goodbye.